In Vale Royal and South Cheshire CCG, we spend a lot of time talking about our nursing home scheme and what it means in terms of hospital admissions and reduced hospital admissions, but we don't capture some of the softer stuff that I think that we get from having our nursing home schemes, and what I think it has done is improve the general quality of care in our nursing homes. So in the nursing home scheme, a GP comes to each nursing home in the town every week and they look at patients and they have opportunity to talk to relatives. Relatives know when the GP is going to be there so they can drop in for conversation.
Westwood Court is a 56-bedded home. We're looking after the people with the dementia and people with the mental health need. And the care we're trying to provide here, in the last few years, we're trying to change the culture of the care, just looking after people, just feeding, caring, give the personal care to another level, like more involved with activities, on a daily activities, daily trip out, and things what they like to, and make them happy and living here happily.
We feel it's very important at Westwood Court that each resident has an individual room to reflect on their personality and their personal needs. So when a new resident's coming into the home, we find out their likes, their dislikes, if they have any favourite football teams, their favourite animals, and then they'll be able to go out and choose what decoration and personal effects they would like in their room. So it's very personal to them because obviously it's their home and it's one of the most important things that they feel comfortable, and that's really important to us here.
Been here for 18.5 years, I feel like I make a difference. I know every resident on a personal basis because I take the time to go and speak to everybody. We make everything from scratch, everything's homemade. I buy everything in that they ask me on a personal basis.
The board is showing that the activities that we offer on a daily basis, all in pictorial form, so that everybody can see the different activities. There's also a weekly planner, so people can plan the week for the activities that they want to take part in and the ones they're not so bothered about, so they can arrange visits, trips out with other sources and still access all our activities that they wish to.
I've worked at Westwood Court for 13 years. I started off as a care assistant, made up to senior, made up to team leader. I work on both floors. I enjoy it being here. The care here over the last few years has changed from basic care, personal hygiene and things like that, now to more person-centred for each resident. Each resident that's here, we have a person-centred care plan with what they like and what they don't like. The activities here are not always planned because sometimes it's just spontaneous.
You know, it's more like home, more activities and things, you know, which you didn't have before. We just do voluntary work with the garden and any little jobs, painting and bits of things, you know, the furniture and things, garden furniture, we paint that, and it's just to make the place, you know, a bit more like home, isn't it, really?
I think the staff generally make it a lot better than other places because they're so interactive with the residents, and there's a lot going on all the time. They're doing lots of singing and activities, and when my dad first come in here, it took him a while to settle because he was so outgoing, and they adapted everything to his needs and got him different activities going and things like that, so that was really good. It helped us realise that he would be looked after properly in here, and they were doing everything for my dad's personal needs as well as everything else.
The fact that we emphasise quality of care in nursing homes like this, it improves the morale of staff in those nursing homes, it makes patients feel involved in the care of their relatives in a way that we might not be able to do without these schemes, and indeed the way we didn't before we had these schemes. And I think that it's very important that people are aware of those softer benefits.
I love my job, yeah.
Love it.
Smiles on faces. That's what my job's all about, and at the end of the day, as long as somebody's actually enjoying it, I'm doing my job right in my estimation.
Yeah, I love my job.